Another possible cause of the shoulder pain is bad habits. People sleep on the side. That is the worst habit to be in, which most of the time is the worst habit that causes shoulder pain. Okay, because when you sleep on the side, your head is tilted 8 hours a day. Your arms is squeezed up. Your ribs get mashed up. Okay, so I always tell patients, no sleep on the side. Your working environment, you work, and let's say you work as a nurse, you always carry patient with this arm. Always carry patient with the wrong position, with the wrong force. Okay, on and on, ongoing bad habit in working environment will cause a lot of damage to your shoulder. So I always tell patients, if you have a issue with the work habits, either you're gonna change work habits or rest maybe a month or two. Okay, that's how you get better. Because if you do not rest and we treat, you get damaged, you treat, you get damaged, you never ever get better. Right? Last but not the least, cancer issue. What I have found over the years that patients have cancer, they cause pain. Cancer causes pain. If you have cancer in the blood, cancer in the lymphatic system, they will cause pain in the shoulder. They will cause pain in the muscle, and the pain is unexplained, and pain is not treatable. If you have cancer issue, you gotta go to the cancer specialist. Okay. Of course, we'll find out just by doing MRI, we should be able to find out. Just by doing the pulsing, we should be able to find out if you have any kind of cancer issue or not. All right. Now, you have heard all these different reasons, all these different causes. Now, when I treat patients, I always tell patients at the beginning, I look at your body like an onion. You know, just look at the picture here. Okay, onion. Why? Because layers. There are layers upon layers upon layers upon layers of issues. Just the shoulder by itself, you know, just think about shoulder. There's so many different structures in the shoulder. Let's just, for example, if I found out that, let's say you have multiple issues. You have issue with the shoulder, muscle, you have shoulder with the tendon, the ligament, the bursas, the nerve. You got problem with everything. Okay, let's just go to the muscle alone. Muscle in itself alone have issue with food, issue with allergy, issue with toxicity, issue with autoimmune, issue with the blood, the lymphatic system. Okay, so we're peeling off layers as we check your body, as we check the shoulder, as we treat the shoulder pain. We're taking layers and layers and layers of different things away from the body. That's how you get better. Okay, so always think of it onionology. So let's say, for example, inflammation could be the first layer. Toxicity could be the second layer. Nerve damage could be the third layer. Autoimmune could be the fourth layer. So that you take out one by one. When all the layers are gone, when all the onions are gone, your condition is gonna get better. Your treatment, your shoulder is gonna get better. Okay, for sure. For sure. And this is what most doctors do not do. They don't check for layers. They just check one thing. And then if they cannot, they treat you for that thing. If it doesn't work, they refer you to another specialist. Another specialist, all this testing cannot find out, they refer you to another specialist. And none of the specialists ever look at the shoulder pain in regards to the whole body. Never. They never look at the shoulder in regards to the food, the work environment, you know, your thoughts, your emotion, your stress level. Hardly any doctor look at all the thing in relation to the shoulder, but I do. I do that for everybody, every single patient. That's why patients, when they come in for treatment, they all spend a long time, every single one of them. We spend a lot of time with patients in detailing them, in checking them in detail. Every single session they come, I personally check with them every single layer to make sure that the layer is gone. Then we go to the next layer. Just keep on checking, keep on taking care of the layers. Okay, that is really the only way to get better. Only way. Okay. Now we're going to talk about different diagnoses, different way to check. All right, to check for different things. Now, whenever you have a shoulder issue, always do MRIs. Always. If you have a simple shoulder, you're not going to come to me. Not really. You're going to go to a physical therapist, and you're going to go to a massage therapist. You're going to get better. Okay. patients that come to me are those that do not get better with everybody else. Those that patients are having problem for 10, maybe 5 to 10 years, and have tried everything and it doesn't work. Those are the patients that I take. Okay, if you are one of those, you gotta do MRI of the neck and the shoulder. You gotta do X-ray, neck and the shoulder. You gotta do blood tests. Okay, we talked about it before. Blood tests for the complete blood test, red blood cell, white blood cell, glucose, check for liver, kidney, check for thyroid, check for autoimmune, check for inflammation, check for homocysteine, uric acid, methylation, food sensitivity testing, and you gotta do the live blood test, prick a blood to see if there's any bacteria, virus, fungus, parasite. Then we also offer some neuro exam to see if there's any issue of your shoulder coming from the brain. Okay, the neuro exam does that. Okay, I'll discuss with you when you come over. And there's Chinese medicine pulse, which I will also do that with you to pulse to do your pulse to see what's going on with the whole body as well too, which I will discuss it more later on. You're going to be doing surface electromyogram. Okay, well, I'll show you what that means. Okay, so again, let's go a little more detail in each items. If you do the blood test, CBC, blood test, glucose, sometimes if your blood sugar is high, then we determine that by HbA1c. Then we test for iron. Now, if you have extreme maybe arthritis in your shoulder, then we check for RA, NA, ESR, uric acid, homocysteine. These are the inflammation marker of the shoulder. Okay, we check for electrolyte panel to make sure you have enough nutrient to your muscles. Okay, we check for liver and kidney, AST, ALP, BUN to make sure that your liver and kidney are doing well, they're functioning well. Okay, so we take away the toxicity, that issue. Sometimes the thyroid would cause pain to the shoulder. Sometimes it does. So we check T3, T4, TH, and TPO. TPO means the autoimmune issue that may have affected the shoulder. Okay, we check the lipid, we do another California allergy panel, which is, we talk about different food sensitivity. We check the egg, the soy, the wheat, all that good stuff. Okay, we might do thyroid testing if you have further issue with autoimmune issue. So thyroid testing is specially used for autoimmune, which we discussed before. Okay. Now this is the live blood test we talk about. You prick a little patient. You can do that yourself. You do a little prick a little hole in your finger, and then one drop of blood come out, and we look under the microscope, right? And the microscope is going to show that this, for example, this is a normal red blood cell. This is a messed up red blood cell. Okay. This is a red blood cell that's all clumped together because you got a really bad diet. Okay. This is uric acid. If you have uric acid in your joint, we'll pick it up in the blood as well too. If you have any bacterial infection, viral infection, parasite, fungus, it's going to show up in the blood. It's going to show up in the blood as well too. All right, this is a great test, really wonderful test. Okay, this is a surface electromyogram. So this is how it is done. There's a machine that we run through the entire spine, and with each section, the computer is going to pick up problem area. If any area have red, then we know there is an issue in regards to the spine. We do this only if we want to determine that if the shoulder pain is coming from the neck. This is one of the ways to determine. Okay. All right. We also do some neurological exam during when you come for the free consultation as well too. The neurological exam, very simple. Basically, what we do is patients sit down here, and then I get a tuning fork, right? And I would test one finger against the two shoulder to see if all the sensation of the finger and shoulder are normal. If they're not, there's some nerve blockages for sure. Okay. I also do two pointing, such as I would, 1 point here, and you tell me how many points I'm touching. So if it's 2 point, okay, 3 points. So this is just testing sensations as well. Okay. And I will also move your finger in different direction to see if you can feel the spatial sensation of the fingers. All right. If you cannot do these, if there's no feeling of fingers, we know for sure you got an issue with the brain. a nerve for sure. So we gotta deal with the nerve, either the brain or the neck, okay? All right, and Chinese pulse system, which I will discuss later on in the future as well too. All right, and the possible treatment option, I will also discuss as well.